Hi, Madeline Lowry, nutritional therapy practitioner and MAP method practitioner. In this video, I want to talk about kinds of physical issues can be addressed through the MAP method. So there are a number of physical issues that I think, and in my reading, have seen other practitioners find success with when working with unconscious or repressed emotions. So in the mind-body prescription, as I've mentioned before, I started working with back pain and all kinds of chronic pain syndromes and found that unconscious and repressed emotional factors were primary. In the emotion code, Bradley Nelson talks about how he describes them as trapped emotions cause many different physical manifestations in the body. And then also in Gabor Mate's book, When the Body Says No, he talks about how repressed emotions from childhood, as well as trauma, events throughout life, can culminate in serious physical illnesses, including ALS, cancer, autoimmune disease. But in my readings, in my conversations with my colleagues, and in my own practice, I've come up with a set of physical issues that I think are the most responsive to the MAP method. And these include the musculoskeletal, back pain, joint pain, tendinitis, carpal tunnel, sciatica, bursitis, muscle tension, muscle spasms, and the GI tract, digestive distress like irritable bowel syndrome, stomach aches, leaky gut, diarrhea, constipation, when these are chronic, nervous stomach, reflux, and nausea. Immune dysfunction also can be related to unconscious emotions. Certainly allergies and sensitivities, which is where I started, right? Whether they are food, chemical, electromagnetic field, or environmental irritants like mold, pollen, dust. Recurrent infections, sinus infections, urinary infections, and the like. Chronic viral infections, Epstein-Barr, mono, and bacterial infections like Lyme, as well as autoimmune conditions. I found chronic fatigue responds very nicely to the MAP method. Chronic pain, aside from what we already talked about, including things like migraines, headaches, mouth pain, fibromyalgia. Eating disorders, cravings, unexplained weight loss or weight gain, restricted or limited eating patterns, any other self-sabotage type patterns, fears, phobias, anxiety, depression, stress, panic attacks, right? These all respond extremely well. High blood pressure, sometimes, frequent urination, dizziness, vertigo, tinnitus, POTS, postural orthostatic tachycardia syndrome, and mast cell, MCAS, mast cell activation syndrome, as well as skin disorders like acne, eczema, psoriasis, hives, and flushing. And finally, the kind of behavioral pattern type things like stuttering, stammering, tics, tremors, and even mystery illnesses. So as a general rule of thumb, I feel like if there isn't an acute injury present or an active disease state that these symptoms can be attributed to, and sometimes I have to say, sometimes people come to me with, for example, Lyme disease. They come with all kinds of symptoms that they've attributed to chronic Lyme, which upon deeper investigation seem not to be related to the Lyme disease. I mean, both are going on in the body at the same time, but it doesn't seem like one necessarily caused the other. So when there isn't an active disease process or an acute injury, I start to think about, what does the subconscious mind have to do with this? Now, if you're wondering, how many sessions does this take? I would say that for phobias, simple phobias, um, um, and specific episodes of, I don't know, like emotional distress, like that thing that happened to you a while ago, but it just keeps coming up for you and makes you feel anxious every time, or makes you, feel emotionally upset every time. That's something that we can work on 1 to 2 sessions typically. For things that are more complicated physical symptoms, I say a good trial is between 4 and 6 sessions. And then for things that are very complex and very layered, that will take maybe 10 plus sessions. So I put in that category things like fibromyalgia, like autoimmune conditions, and things like eating disorders. Um, so I offer that to you as some kind of guideline, maybe, for what we can use this new method, the MAP method, to work on in terms of physical, chronic physical health issues. And I invite you again to book a 15-minute free consultation and discuss what your issues are and how the MAP method may apply, if it does at all. Thank you for listening.